action potentials in the heart. So first off, what do we know about heart muscle? How is it different than everything else?
Gap junctions.
Gap junctions, good.
Individual little cells instead of big, long.
Good. So what does the gap junctions mean? I mean, what does that do functionally?
It connects the cells.
Yeah, so literally all the cells share the same cytoplasm. Good. So how does that affect the way the heart works?
It's
Yes, automatically.
Sort of. I mean, so the gap junctions don't make the action potential happen automatically. I mean, the gap junctions basically means that if one cell gets stimulated, they're all going to get stimulated, right?
right.
But what does make them happen automatically? What does make that action potential just happen?
The open calcium channels, sodium channels.
Open sodium channels, good. Yeah, so they reach threshold all on their own because they have sodium channels that are always open. Good. So let's take the SA node, for example. For the SA node, Brother Ray doesn't care if you know like all the different channels and what's going on at every stage. For the regular cardiac muscle he does, but the SA node he doesn't want to make it any more confusing. So yeah, we have these sodium channels that are always open, and so that's just going to constantly get us going towards threshold. Don't need any other stimulus, it's just going to go towards threshold all on its own. So then at threshold, obviously we get our depolarization, come up, get our repolarization, back down, and then those sodium channels start to get us depolarizing again up to threshold. That's pretty well that simple. But that's the idea, is that those sodium channels are always open, so we're always moving towards threshold.
Should we know like every phase? So like depolarization, repolarization, phase?
For the SA node, that's all you have to worry about is this right here.
Okay.
I mean, you have depolarization and you have repolarization, but
Yeah.
this SA node's pretty simple.
Closing, nothing after that.
Not for the SA node.
So calcium channels open, so and then in depolarization the voltage potassium close.
For the SA node, I wouldn't even worry about that part.
Not at all.
Not at all. For the cardiac muscle, yes, but for the SA node, don't even worry about it because it's different. It's a little bit different than the cardiac muscle. And at least for Brother Ray, he doesn't want you to get confused between the two, so he just talks about the other one. Doesn't even worry about this one.
So repeat one more time exactly what we should.
There's sodium channels that are always open, and so you're always going to threshold.
That's it.
Nice.
Okay. So, how do we speed up or slow down the heart? So there's two types of regulation, intrinsic and extrinsic. What does that mean? What is intrinsic regulation?
Does that have to do with something like in the heart? Intrinsic?
Yeah, the heart regulating itself.
What question was that?
Number 8.
So if we have a lot of preload, which means there's a lot of blood coming in from the vena cava, it's kind of almost backing up, lots of preload, then our heart's going to beat a little bit faster, a little bit stronger. Our stroke volume's going to increase, and the heart does that all on its own. It senses that there's a lot of preload, so it tries to make bigger, more forceful contractions to get more stroke volume.
Stroke volume, what is that exactly?
Stroke volume is the amount of blood, the volume of blood that gets pushed out with each contraction.
Okay.
So the heart will try to have more stroke volume to kind of catch up. And so basically the blood is damming up behind the heart, and so it's going to try to contract more to clear that out. That makes sense?
Yeah.
Or vice versa. If there's not as much preload, then the heart's not going to contract as forcefully because we don't have enough.
So what would cause a greater preload?
there's disease conditions that can cause it. That's probably the biggest one.
I want to talk about Starling's law of the heart.
Mm-hmm. Yep.
So when the walls are stretched.
Right. So the greater the preload, the more the walls of the heart are stretched, the greater the stroke volume is going to be.
And that's Starling's.
That's Starling's law.
That sounds familiar.
The greater the preload, the greater the stroke volume. Okay. So let's talk about extrinsic regulation. What does that mean?
Outside the heart factors that affect.
Good. So what's our main extrinsic regulation?
Hormones.
Hormones and neurons. So mainly sympathetic and parasympathetic stimulation, right? So what does the sympathetic system do to the heart?
Increases heart rate.
Good. And how does it do that?
Baroreceptors.
Baroreceptors come into it.
Or releasing.
Releasing epinephrine, good. So epinephrine increases heart rate. What else does it do to the heart?
So it contracts more.
Contracts more. That also contracts harder. So not only do we have increase our heart rate, we increase contractility. So it's faster and harder to push more blood through. So how does epinephrine work then? How does it make the heart go faster and stronger?
Does it open up the vessels more?
It can open up the coronary blood vessels. Most blood vessels is going to constrict, but actually the coronary arteries and those could actually dilate a little bit to get more blood flow through the heart. So epinephrine opens ligand-gated calcium channels. And by doing that, we don't really have a resting membrane potential in the heart because it's never resting, it's never staying the same. But if we were to call this our resting membrane potential just because, by opening those ligand-gated calcium channels, we raise our resting membrane potential. So now, instead of having this distance to cover, we only have this distance to cover. So I can depolarize like normal, but I only have to go this far. And so my heart rate, with my terrible marker, gets faster, right? It's not a perfect drawing, but you get the idea. So with epinephrine, we have the nervous stimulation. So those nerves are going to connect to the SA node, and then also like the hormone. It's going to give the heart a big epinephrine bath. So the whole thing's going to be contracting harder and faster. Okay. So then, what does the sympathetic or the parasympathetic system do?
Slows it down.
Slows it down. How does it do that?
Closing. It goes away.
It's actually going to
Calcium
open. It's going to
Calcium channels?
not calcium channels. It's going to open a different channel. What channel might we open if we're trying to make our resting membrane potential even more negative? Potassium. Good. So, yeah. So acetylcholine opens ligand-gated potassium channels, which hyperpolarizes the heart. So now we have more distance to cover. We still get the threshold at the same rate because we have the same amount of open sodium channels, but we have longer distance to cover. And so our heart rate is going to be slower because we have to travel so much farther. That makes sense?
Does it also change the force of the contraction?
Yeah, the contraction, it's not going to weaken it as much as epinephrine strengthens it. But the contractile force might go down a little bit. But for the most part, our normal contractile force is what we want. We don't typically want to make it weaker, but a little bit maybe.
So after talking about ACH, the study guide asks under what conditions would ACH be released? I didn't know, but just when the heart is beating faster than normal, or?
Any parasympathetic stimulation is going to cause ACH.
Or sympathetic.
Sympathetic would cause epinephrine.
Oh, epinephrine.
Parasympathetic would cause acetylcholine.
So just resting.
But
Well, like I say, any parasympathetic stimulation. So say you were just working out, you had a bunch of sympathetic stuff going on, you get done working out, parasympathetic's going to kick in and bring you back down.
but parasympathetic also involves epinephrine.
Parasympathetic does not.
Totally separate.
Totally separate. Remember, sympathetic is our fight or flight, prepare for stress division. And then the parasympathetic is our rest and digest, feed and breed division.